Hello, my name is Teresa Connolly. I'm the clinical nurse educator for the pediatric units at Baystate Children's Hospital. And today I am going to talk with you about the recommended ways to take a child's temperature. Temperature tells us a lot about children. It tells us when they're hypothermic or when they're cold, and it may mean that you need to bundle them up a little bit more. It can also tell us when their temperature is too high or they're hyperthermic. When a child is irritable and they're warm to touch, take their temperature because they probably have a fever. One of the most important things is that you get a digital thermometer. Glass thermometers have mercury in them, and they're glass, and they can fall and they can break, and they pose a hazard for a child. The three temperatures that are the most common, that we use the most in pediatrics, first is the axillary temperature. And the axillary temperature is a temperature we get under the child's arm in the armpit. The axillary temperature is going to register less because it's not actually registering the core temperature. That temperature is going to be about 1 degree less than the core temperature. The second one is the oral temperature, and the oral temperature is when we put the thermometer under the tongue. The child has to be developmentally cooperative in order to take a temperature under the tongue. And then a rectal temperature, which is probably the most accurate, and it's the gold standard for pediatrics. Any patient or any child can have a temperature taken rectally, but it's the most invasive, and so you really want to reserve that for the younger children. When you report a temperature to a physician, you always tell them which way you took the temperature. So if you took an axillary temperature, you want to make sure the doctor knows that. The other important thing is, if you take axillary temperatures, always take axillary temperatures, because that will give you a trend of how the child is doing.